Hi, my name is Ogweno Stephen. I'm the CEO and founder of Storylink. Storylink is a youth-led social enterprise whose primary ethos is to make information and diagnostic services for non-communicable diseases such as cancer and diabetes available to all at all times in relevant formats. To do this, we do this through innovative community projects and also through innovation and leveraging on existing technology to be able to deliver information on healthcare. To date, we've had 7 projects that have been able to work across 8 countries in Africa, with one of our biggest projects for 2020 being NCDs 365, where we've been able to work with 14 partners across 8 countries in 4 languages, communicating daily messages on non-communicable diseases. Through this project, we've been able to reach over 1.3 million people by June of 2020, and cumulatively through the works that we've been able to do at Stowelink, we've been able to reach more than 4 million people as of June 2020. We've also been able to hold quarterly medical camps since 2016, where we move into various communities and partner with various organizations to conduct screenings and diagnostic services for communities. And to date, we've been able to screen 96,700 plus people in 5 counties in Kenya. To add on top of that is that in 2020, during the COVID pandemic, we're able to work with the Non-Communicable Diseases Alliance of Kenya to go into Vihiga County and work with 5 groups of people living with NCDs. And as a result, we've been able to reopen 4 clinics, which we were supporting through provision of medical equipment and provision of services, so that the NCD community is always attended to despite the pandemic and despite the challenges that came with pandemic. At Stowelink, we strongly believe that innovation is the way to go, and especially in primary healthcare, we believe that innovation is the future. It's to this end that we are constantly innovating, constantly ideating and coming up with new ways to ensure that health messages are able to reach the last mile communities in Kenya and in Africa. To this end, we've been able to incorporate art to do health projects, and we've been able to host 5 poetry competitions, which have been able to attract more than 1,000 poets across 6 countries in Africa. And we've been able to have 2 anthologies written on that, and these books have been able to be distributed to schools and communities where young people are able to learn about non-communicable diseases through poetry and through literary works. More than that, we've been able to develop games and board games for non-communicable diseases. And through these board games, we are getting parents to play with their kids, we are getting parents to play with other parents, and this way they are learning about non-communicable diseases while at the same time having fun and playing the games. And finally, even as we look into the innovation space, we've also been able to get into the MHealth field, and for the past 3 years we've been working on developing a mobile application and a mobile application system that will be able to help people learn about non-communicable diseases, connect with organizations that provide services for non-communicable diseases, and more than that, update people on the various medical camps, events and activities happening that are concerning non-communicable diseases. And this development and this process led to the development of the NCDs 365 mobile app. And this app was developed first in 2016, and a cohort study was used to identify what exactly do people want in a mobile application. And this led us to developing the NCDs 365 mobile app, which is now released on Play Store. And it is enabling you to learn about non-communicable diseases, connect with organizations and institutions giving services for non-communicable diseases. And more than that, you're able to get updates and news and information on the latest developments and medical camps around you as it concerns non-communicable diseases. As I move to conclude, I'd like to really invite partners, I'd like to invite stakeholders, I'd like to invite individuals who are passionate about non-communicable diseases, who have a say about non-communicable diseases, who want to make a change in this field, and I want to invite them to partnerships, I want to invite them to collaborations, I want to invite them so that together we are able to work towards eliminating non-communicable diseases and achieving Sustainable Development Goal number 3 and especially Sustainable Development Goal number 3.4, which states that we are able to reduce by a third the deaths and suffering caused by non-communicable diseases by 2030. And as I conclude, in case you didn't know what these non-communicable diseases are, these are cancers, these are diabetes, this is obesity, this is your chronic lung diseases, this is cardiovascular diseases like stroke, and these diseases are the leading killer diseases in the world and in Sub-Saharan Africa. So, do you want to be part of the change? Do you want to be part of the movement? If you do, please reach out to us on our website at www.storylink.com, and together, let's beat NCDs. Thank you.